Hepatitis C is a virus that damages your liver. The liver is an important organ in our body that does lots of jobs to help keep us healthy. If left untreated, over time hepatitis C causes scarring on the liver, which can lead to liver failure and increased risk of liver cancer. Symptoms for hepatitis C can be very general, like feeling tired all the time and feeling run down. However, not everyone will have symptoms. It is important to remember that your liver can still be getting sick or damaged without feeling unwell, and sadly, some people only find out that they have hepatitis C once their liver is already damaged. Hepatitis C is a blood-borne virus, which means that it can spread through blood-to-blood contact. This can be through injecting equipment or even backyard tattooing. Anyone who has been in jail or had a blood transfusion before 1990 should also have a checkup for hepatitis C. This is a simple blood test you can have at any health service.
So my name's James Ward. I'm a Pinjarra and Narungga fellow from Central and South Australia. I head up a research program at the South Australian Health and Medical Research Institute. Rates of hepatitis C in Aboriginal communities are much higher than they are for the non-Aboriginal population. So for example, we represent 3% of the total Australian population, but around 10% of all the Hep C in Australia is among Aboriginal people. And really the rates have been increasing over the last 5 years while they've been decreasing in the non-Aboriginal population, and that's something we're very concerned about. People who inject drugs really are the major risk population in Australia. There's a high proportion of Aboriginal people that are sharing when they're injecting, and that's really an issue. And so the other real risk factor I think for Aboriginal people is the prison environment, and so lots of people in prison have hepatitis C. It's a place where there's not usually clean equipment, and lots of transmission probably is occurring in the prison setting. And then when people are released from the prison setting, not knowing their status, go back out to community and unknowingly transmit hepatitis C in the communities.
My name is Auntie Irene Allen, and I'm a Thangao woman from the southeast, South Australia. My mother's from the Western Arrernte and my dad is Thangao from the southeast. I think for some Aboriginal people it's fear, and a lot of it is shame too, to go in, to get, diagnosed with something. If they're not well, they're afraid to find out what the results would be. I think it's really important for people that have got Hep C to come in, especially with their mob, to come in and get treated. It's quite easy now to be treated and to keep our community and culture strong. I always think life's so precious, and children, you've got children around you, they want you to be healthy so that they can do stuff with you and you can teach them and be a role model, I think, for the children.
Treatment for hepatitis C is now better and easier. The first step is to have a blood test to see what strain of the virus a person has. This will help determine what medications to treat with. Clients will also have other tests, like a fibre scan, to look at the amount of scarring on the liver. This is a very quick, easy and pain-free test. People who go on treatment generally only take 1 or 2 tablets per day for 8 to 24 weeks, depending on what strain of hepatitis C they have and the amount of cirrhosis, which is scarring on the liver. The new treatments are interferon-free, which means no regular needles once a week, and there are very few side effects compared to the old treatments. It's very important to take the medications every day, and your local Aboriginal health service can help support you with different ways to keep on track with your treatment. The new treatments have a very high cure rate for being hepatitis C free.
My name's Anne. I'm a Ghana Narungga woman from the Barossa and the Yorke Peninsula. I had a few issues with drugs in the past and was feeling a bit lethargic, getting older, and thought I'd have a blood test, a general blood test to find out, because I had iron deficiency in the past, and it came positive for hepatitis C. The motivation for me to do the treatment was not only for myself, as I am getting older, but also for my family and for me to be able to take care of my nieces and my nephews and be a bit of a role model for them. Family was a big motivator.
I'd be saying, if I had a friend or a brother or an extended family member, a cousin, if they're living with hepatitis C, that it's a major breakthrough. You need to go and see a doctor, go to your Aboriginal Health Service, talk to them about Hep C, say you've been diagnosed with Hep C, you want to start treatment, get it done, your liver will repair, you'll be cured of the disease. 2 or 3 months you'll be feeling a whole lot better than you currently are today. So go and get it done, take the time, look after yourself, and it's for you, it's for your family, if you've got kids and so forth. Think about them, think about the longevity of your life.
If you have hepatitis C or you're not sure if you have hepatitis C, just go to your local GP or health centre and get a test. It is an easy test and the treatment is really easy now. Don't only do it for yourself, do it for your family. It's made me a much healthier person and it can extend your life and be there for your children, your grandchildren, your great-grandchildren. Be there for your family.